All right, so today's notes are over blood pressure, and then we'll kind of do a lab that deals with taking measurements and learning how to actually take recordings of blood pressure. So whenever we say blood pressure, what we're saying is basically the force that you're feeling against the inside walls of those blood vessels. And this would obviously be referring to the artery pressure, since that's the one that's getting pushed directly out of the heart. It's kind of the strongest force there. There's not much pressure left over as it comes back through a vein. So we'd be measuring blood pressure from the artery. There's two kinds of pressure. There's systolic and diastolic. And systolic is like the maximum push coming off of that left ventricle. And so it's always measured in millimeters of mercury. It's just kind of the old-fashioned way of measuring it. We don't really use mercury measurements anymore. It's just still kind of read in that same system. So maximum should be right around the 120 mark. And then diastolic is basically what's the pressure that remains in your arteries before that next contraction comes. That's called diastolic, and that's average is right around 80. So when you take a blood pressure reading, you put the top number, systolic, over the diastolic number below. So it'd be like a 120 over 80. And we'll kind of talk about what normal is. That, like we said, that's average. So once you start getting above like 140s, that's really high. Getting below 100s for that top number, that's really low. Whereas diastolic, your range is a little bit more limited, like 70 to 90 is kind of considered normal. So it just kind of depends on the person too, and it's good to know what your normal blood pressure is, kind of where you sit at. And then pulse is basically the actual expanding of the artery walls, and so you can actually feel this through your skin. There's different places to take pulse. This picture is showing radial pulse, so you just take like your two fingers, and we always use like the pointer and the middle, just so that you aren't confusing it with your own pulse. A lot of times, like your thumb, you'll feel your heart rate a little bit more. Ring finger, you'll feel it a little more. So that's kind of why we use two fingers. And obviously the radial pulse, you go right along that radial artery just under the thumb. Some other good spots to take pulse would be like the carotid arteries up the side of the neck. You could do it on your temple, on the side of your head. You could do it in your armpit. You could do it down in the groin. Some people have really good luck like down on the inside of like their ankle bone, like kind of right behind, the kind of the back side of where the inside of the ankle is. So there's lots of different places behind the knee, in your elbow. So anywhere where the skin would get just a little bit thinner so that you could actually put your fingers there and like feel that pulse. So some things that can influence blood pressure would be what we call stroke volume, and this is basically how much blood gets pumped out of the left ventricle with each contraction. And again, average is for an adult male, and we say roughly 70 milliliters per contraction. So cardiac output is what we call stroke volume times the heart rate. So there's a little bit of an equation here. You would take that 70 mils and then take your heart rate, which is basically just your pulse rate, and average for that is 72 beats per minute. That's like a resting normal heart rate. When you start getting lower than that, you're considered just, maybe a little bit healthier, a little more in shape. If you're up in the 90s on a resting heart rate, you're just considered maybe a little bit more out of shape, that kind of thing. So the heart's just working a little bit harder. So if you just kind of input your stroke volume times your heart rate, that's our cardiac output. So doing a little bit of math there, 70 mils times 72 beats per minute, and that's roughly over 5,000 milliliters per minute coming out of the heart, which is a pretty good amount of blood being pumped out every single minute. The other thing to keep in mind is if your cardiac output goes up, that blood pressure is also going to go up because the heart is working harder to pump all that blood out. So if that beat per minute is working harder and you're always at like a 90 resting heartbeat, you're pumping out a little bit more blood every single time. So we would expect to see blood pressure to also go up. Blood volume, just like it sounds, is how much blood do you have? We said 5 liters is pretty normal for adults. That includes all of the solid red, white blood cells plus the platelets plus the plasma. And so if blood volume goes up, you're going to have to pump more. And so blood pressure is also going to go up, or vice versa. If your blood volume drops down, like you lost a lot of blood during a surgery or maybe in a car accident, something like that, well, blood pressure is also going to go down. And so that's why we would want to get somebody who lost a lot of blood, you'd want to give them a blood transfusion, get them more blood as quick as you can, try and get that blood pressure back up because we're not getting oxygen to tissues, and that's when it becomes really dangerous. Another thing that can influence blood pressure is something called peripheral resistance. This is just the friction of blood flowing through your vessel walls. So obviously there's just a little bit of friction happening, and that's just kind of slowing blood down. And so any sort of muscle contraction would cause this sort of peripheral resistance to increase. And so then blood pressure has to go up to kind of counteract that force. So, things like working out, well, obviously we have a lot of muscle contractions occurring. Smooth muscles are contracting, and so blood pressure is going to rise to kind of counteract that a little bit. And then another thing that can influence is what we call viscosity. It's basically how easily do the molecules flow past one another. It's like the thickness of your blood. So if viscosity goes up, resistance to that blood flow is going to go up. And so again, your heart rate is going to increase. Blood pressure has to rise because it's actually having to pump a lot harder because your blood's just thicker. So things that can make blood thick would be certain medications. One of the most common ones we see is like people who do an excessive amount of like protein, those pre-protein workout shakes, those kinds of things. It definitely just, is helping build muscle, but at the same time, you're increasing this thickness of your blood. And so sometimes, high blood pressure becomes kind of a side effect of taking extra protein in your diet. So how do we control blood pressure? We would want to monitor that cardiac output, how much blood are you pumping out per minute, and then also try and limit peripheral resistance. So there is a law here, it's called Starling's Law of the Heart. It basically just says however much blood you discharge has to be equal to the amount coming back in. And so there are special receptors called baroreceptors. They sit in the walls of your aorta, and what they do is they can kind of pick up when maybe not enough blood's coming back in or too much is coming back in, and we kind of counteract that and adjust how much blood we're pumping out based on how much is coming in. So it's actually being monitored, especially the aorta is like, okay, a whole bunch went out that time. So it sends that message to the medulla, and then the medulla kind of helps set the pace of the pacemaker of the heart and like how quick we're going to pump that heart and get your blood either increased or decreased back down. So, and these are just reflexes. So the cardio inhibitor reflex, just like it sounds, if you're getting increased blood pressure signals, we send that to the SA node, that pacemaker of the heart sitting in the upper right atrium. And so then we would kind of inhibit or slow down that heart rate and try and get you back to a normal level. Cardio accelerator does the opposite. So if blood pressure is getting too low, we send that message to the pacemaker, and then it kind of increases the beating, trying to get your blood pressure back up again. Excuse me. So in the medulla oblongata, it's called the vasomotor center. And that's what is helping to regulate those smooth muscle contractions and try and keep your blood pressure at a normal level. Again, some other factors that would, basically affect blood pressure would be working out, physical exercise. Blood pressure is going to go up. You're just trying to get more oxygen to your tissues, so we need to increase that blood flow. And so blood pressure just has to go up to counteract that. Body temperature plays a big role. If you're hot, blood pressure is going to rise. We need to dissipate some of the heat, pump blood a little faster. If you're cold, blood pressure is going to decrease. We want to kind of retain the body heat, slow that heart rate down, so cardiac output is going to come back down. And then emotional responses. Again, things are kind of limbically linked to that medulla. So if you are having a fight or flight response, sometimes basic emotional situations can cause people's blood pressure to really go up. Pulse rates start to skyrocket, things like that. And it is just, nothing necessarily physical is happening, but because of the way that they're linked in the brain and wired to each other, the body responds physically to something emotional. And then as blood comes back through your veins, just keep in mind that there's not much pressure left. And so we do have to have some muscle contractions to basically push the blood from one valve section to the next. And we just call it a venoconstriction. So again, the blood will kind of get squeezed by the smooth muscle here from one of these little sections up into the next. And we have those valves in place that will snap shut when blood starts to flow backwards, like with the force of gravity. And then hopefully, blood won't go backwards in this system. So we just kind of slowly push it upwards back to the heart section by section. If somebody has high blood pressure, it's called hypertension. Keeping in mind, hyper means, above that normal range. Lots of things can cause high blood pressure. One of the biggest ones is just obesity, kind of being overweight. We see a lot of stress-induced high blood pressure. Sometimes people who are overly stressed have high blood pressure to begin with, and then it can lead to, heart attack, something kind of more severe. Kidney disease is often linked with high blood pressure, and then obviously having too much salt in your diet. And Americans just by nature have pretty high salt diets, so blood pressure tends to be pretty high in a lot of us. If you don't fix hypertension, the heart is working overtime all of the time, and so it's a muscle. And so when you work a muscle continuously like that, a little bit too much, it starts to enlarge and get thick. And the thicker it gets, the less room you have for blood to sit in those ventricles and to get pumped out of the heart. So cardiac output's going to decrease. And so, how do we fix this? Well, there's medicine that people can get put on. If it's a weight thing, we would, try to control that body weight. Make sure that people are getting regular exercise in their daily activities to try and keep weight in a normal level. For a lot of us, it's limiting salt. And then one of the biggest things would be reducing or even eliminating stressors from your life if that's the cause of it. So this is what a hypertensive heart looks like on the right side. You can see like the wall of the ventricle here has really, really thickened up. And so there's almost no space left here in the ventricle where blood can come in. So again, cardiac output's going to go way down. The heart is going to continue to keep working overtime and work way too hard to do its job. So versus the normal heart that has a lot of space here for blood to sit within. So we kind of have to fix a hypertensive heart, or the heart kind of shuts down, and that's, like I said, what could lead to something more extreme, such as a heart attack. So, okay, so I think that covers the notes over blood pressure. We're going to have you watch a quick YouTube video on how to take blood pressure readings. And then your lab today is up on Schoology, and that's going to deal with recording pulses and blood pressures, and you'll just kind of have to practice and, watch the video. It'll walk you through how to do it properly, and then just kind of keep practicing on each other until you understand how to do these correctly. All right. We'll see if we can stop this. There we go.